Good evening to everyone and welcome to today's session. AIMS exam is always historical. The questions are phenomenal and the way you answer is not just what the knowledge you have, but also a common sense application and the ease with which you can be able to take the paper. So they are all the essential components of the AIMS and winning the AIMS exam. So how many of you have really taken the recent AIMS, doctor, which was conducted last Sunday? Oh, you are fresh. Very good. So we have our online students, Dr. Shahila, Priya, Alok, Praful, Femida, Brahmaramba, Sudha, Kumar, and many students of Tirupati, Vishakhapatnam, Vizag, and etc. So let's make the great beginning. So these were all the questions which have been recalled after finishing the exam by some of the very academic students. A lot of times after writing exam, we love to forget about the exam and enjoy the life, which is otherwise very beautiful. So these were the questions which were written by them. So my role is like the King Dhritarashtra, where Vidura will be telling this happened, that happened in the war which is fought in AIMS, Delhi. So let's take up the discussion. Which is the anesthetic of choice for hypotension during surgery if you are operating on a case of aortic stenosis? Please feel more interactive. I love to invite answers from you. That will make me feel like any other regular discussion. So what is your answer, doctor? Possible answer. Which can be able to raise the BP and treat the hypotension. Yes, doctor. AIMS May 2013. Fresh from the stock. Yes, doctor. What is your answer? This is definitely a stock question. You like to say dobutamine? Dobutamine is the choice of Bindu. Praful, Sudha are proposing phenylephrine. Any other choice you like to try? I like to propose ephedrine. Intraoperative hypertension is defined whenever the BP goes less than 25% of the usual value, and the hypotension can be because of a low cardiac output, low systemic vascular resistance. And how do we treat, doctor? Typically, we will be the best drug that you can be able to give to treat it is we need to use ephedrine and meterminol are the ones which are commonly used drugs, is what you need to remember. Now, hypothermia, does it normally happen during anesthesia? If so, is it always bad or sometimes good? Then how do you want to prevent the development of hypothermia? These are all the issues examiner is interested when it comes to AIMS May. What is your answer, doctor? I would like to encourage all of our online students to quickly punch the answers to make the things easier. Okay, what is the guess from the floor members? You are from which college, doctor? Gandhi, eh? Oh, very good. I am happy we have Gandhi, Usmania, the two top colleges of Hyderabad. Yes, what is your answer? Very good. Sudha, Guntur students, Alok, everyone is proposing can be prevented by giving warm fluids. Do we do that? Do we do that? Can it be beneficial for any patient? That's right. Answer is it can be beneficial, as revised by, the answer was revised by Guntur students, beneficial to the patient. Okay. The next question is, there are certain scenarios, I love to leave the literature to you, where it is not always deleterious, it can be very good. In certain scenarios, therapeutic hypothermia is used, especially in neurosurgery cases, and wherever you are doing coronary artery bypass surgery, we basically do it. Now doctor, what is the shelf life of suxamethonium? Anybody can at most remember half-life. So examiner want to know, if not you are a good doctor tomorrow, you can be a good medical shop owner, so that you know for how long shelf life of suxamethonium will be there. So question number 3, what is your potential answer, doctor? Shelf life of suxamethonium. Some guesswork. Manufacturing date to expiry date. What is the discrepancy? Huh? 1 year is a proposal. Your name, doctor? Pranay. Pranay proposes 1 year. Guntur, Sujata, Shahila. Everyone is saying 2 years. And there are few supporters like Kumar and Priya who are supporting Pranay with 1 year, but 2 years. Suxamethonium, it is a clear colorless aqueous solution with shelf life of 2 years, is all about the AIMS exam. So do you think if you read also, can you answer this? Impossible, unless paper is out for you beforehand. You are a part of some scam, otherwise difficult. Huh? It's not a old standard question, right? It is not at all a standard question. Now, this is a standard question. Which anesthetic is contraindicated in epileptic patients classically? Can you give me one confident answer? If you use it in epileptic patients, it is known to decrease the seizure threshold and can lead to the worsening of the seizures. Some guesswork. From there we will try to pass point you. I know that you are all first time exam takers. Possibly what is your answer? The war veterans among our students who previously wrote exam will be able to shoot this in no time. That's right. Akshara says B, but Sudha, Guntur, Priya, Sujata, everyone is saying C. Ketamine. Absolutely. The main anesthetic drug to avoid in epileptic patients are alfentanil, remifentanil, sevoflurane. Ketamine at usual doses also is known to have epileptogenic potential. That's the reason it should be avoided in epileptic patients. And how about propofol, doctor? In spite of the conflicting results, propofol has anticonvulsant effect and is considered safe for the sedation, induction and maintenance of the general anesthesia is what need to be remembered. Now, you are operating on a case, say you are a anesthetist for a neurosurgeon. There is an intracranial space occupying lesion. Which anesthetic you can give which will not be raising the intracranial tension so that it can be used safely? Some guesswork. Anesthesia is purely guesswork, but it is a very standard anesthesia. Anesthesia is subject where you can easily score 4 out of 5. Out of the, which question we are in, 5th question, no? Except that suxamethonium half-life, all the remaining 4 questions you will be able to crack if you have, I don't say attended with us for coaching, but if you have prepared consciously with GCS 15 when you are reading anesthesia. Question number 5, that's right. Everyone is proposing isoflurane, which is the one which is typically used whenever there is a intracranial SOL. Let us talk about celiac block. Celiac plexus is a sympathetic plexus. So at which lumbar vertebra do you have celiac plexus? The other day we discussed in our neuroanatomy. What are the parasympathetic and sympathetic ganglia? So with regard to the celiac block, give me some confident answer, doctor. You like to say L to L1. That's good. I'm happy to know that. Do you use it for lower abdominal malignancies or upper abdominal malignancies? Can you please give the question paper one copy to the doctor, even to the other doctors also? Yeah, question number 6. Akshara, Kumar, Shahila, Sudha, everyone is proposing most common side effect is diarrhea and hypotension. Absolutely. You know, parasympathetic system will lead to motility. Sympathetic prevents motility. Any sympathoplegia will lead to promotion of motility. Hence, there is a development of hypotension and diarrhea. That's good. So, it is not used for lower abdominal malignancies, but rather for the upper abdominal malignancies like pancreatic malignancy. To relieve the pain, we basically use doctor. Now, there is a lot of literature. It's a repetition of what we regularly discuss in our Monday to Friday classes. So, we will host it all like a blog on our website. You can always go through that. No point in felling down the trees with papers. That's the reason we will give you the questions only. Now comes the pathology. Few questions. This is the dirtiest question I have ever discovered in an entrance exam. Micropuncture of the cell membrane with a needle. How will the repair occur? You don't need coaching for this. You don't need any mentoring for this. What you need is, you need to keep your mind cool, CSF still flowing in spite of seeing this question. Then you can answer it in a composed way. Question number 7. Vijay Rohit proposes hydrophobic interactions. Do you think so? You like to vote for it? Any other answer you like to vote? If you do micropuncture, which one is responsible? Guntur is proposing active process requiring ATP. Krishna is proposing linear movement of proteins. Khatam. All the 3 are being proposed. Now the time for me to dispose the case. So, doctor, cell wounding is one of the important driver in the innate immune process in the ventilated injured lungs. This is the place from where the examiner picked up this question. So, one of the important hypotheses is the extracellular ATP promotes the repair of the wounded alveolus, and it is a ATP dependent process. Active process requiring ATP will be responsible for basically repairing if there is any injury to the cell membrane, which is important in the pathophysiology of the ARDS and the ventilator associated lung injuries. Beyond it, it's not worth discussing the question because it won't be repeated in any other exam. It is a unique question mainly to identify whether you are a robot writing the exam or a real human being writing. That's the purpose of setting up this question for you. What is the tumor marker of rhabdomyosarcoma? Give me a confident answer, doctor. Rhabdomyosarcoma. Yes. Commonly is proposing in that earlier question, one of the options is lateral movement of proteins. Yeah. Probably our students who have really taken exam can do the correction of small options. Question number 8. Everyone is saying A except Krishna says D. Priya says C. Cytokeratin, biomentin, desmin. They are the various proposals. What do you want to vote, doctor? Shahila and Sudha are also strongly for desmin. What do you say, Bindu? What is your answer? Desmin? Desmin? Huh? Super. Desmin and muscle actin are typically positive. Desmin is an excellent marker of the rhabdomyosarcoma is what need to be remembered. So what is our deal, doctor, when we were preparing for exam? Without a question on apoptosis, there is no entrance exam, whether it is NEET, state, any paper. And this is the most standard question about the apoptosis which have ever been asked. I was thinking EPA1 gene, direct pathway, indirect pathway. There is a lot of dirty issues in apoptosis. Everything imagination. Nothing to do with intelligence. Right? If you read it, you answer it. If you didn't read, you guess it, you get minus marks and get a negative score. That kind of topic is apoptosis. What is your answer? Shoot me. Question number 9. Sujata, Femida, Kavi, Kunal, Priya, Shahila, Guntur. Many times we have given the same question in our Sunday exams. So, there will be no inflammation. If the inflammation is seen, that is typical of necrosis, not apoptosis. We see all the remaining things in the programmed cell death. Now, doctor, in HIV, another very interesting question. Nothing to do with preparation, but only guesswork, pure guesswork. Which part of the brain does not show atrophy? First of all, you should know brain shows atrophy in HIV. It's a part of the HIV encephalitis. If you know that, then you can say which is spared. Okay, what is your guess? Chalo, how do I guess? Pure guess. You think it is cingulate gyrus globus pallidus chordate nucleus, central white matter, which is the one which does not show atrophy as a part of HIV. Let me see what is the guesswork. Akshara, Shahila, Rohit, Krishna, Sudha, Harika. Everyone is saying central white matter. Only Fahima proposes globus pallidus. What do you want to vote for? I took half an hour to search the answer. I felt like hellish in the midnight. What is this karma of searching such enigmatic questions and their enigmatic answers? Purely theoretical. One big clap goes to Fahima and Sujata, who have answered it as globus pallidus. Absolutely. Compared to controls, HIV patients will have enlargement of the bilateral globus pallidus and a global brain atrophy, which is characteristic of HIV. Encephalitis is what need to be remembered. I think pathology questions are all bouncers, right? If a chromosome divides in an axis perpendicular to its usual axis of division, what will it be forming? Excellent. Isochromosome. I think our biology teacher should be complimented. What he taught in 9th class genetics is still helpful for the MD first year. Question number 11. Rohit. Rohit is clean bowled on this question. How come? Rohit generally is answers correctly. Vijay Rohit. Akshara, Kumar, Akhil, everyone is right. Isochromosomes. Whenever a chromosome divides along the axis perpendicular to its usual axis of division. This is another very standard question. Crumpled tissue paper appearance is typically found in which condition? Actually, I think it was asked, crumpled tissue appearance is seen in a disorder in which substance is deposited in the cells. That was a much more specific, I don't remember. You have taken the AIMS exam? So what, it is not the frame, right? Same frame? Okay, what is your answer? You like to say glucocerebrosidase or Gaucher? Sure? Pakka? Kaun banega AIMS pati? Question number 12. Akhil, Shahila, Jyoti. Sudha is clean board like you, but Gaucher doctor. But this is a standard question. You take any small kuti book for MD entrance, you will have this. So in the Gauchers, typically what will happen? On light microscopy, the Gaucher cells will resemble a crumpled up paper. Actually, I didn't get time to add a lot of images, but this is more an analysis session rather than understanding kind of a class. That's the reason I did not. Stain commonly used for the fungal elements. Remember, every AIMS exam you go without a question on staining. you will not come back with a unstained. So one question every paper of AIMS. Once more you will be, some of you will take November AIMS, no? That time also stain question will be there. Give me one unstaining answer. Very good. Priya, Kunal, everyone is proposing silver methylamine stain. Superb. That's right, doctor. Periodic acid shift and methylamine silver are the two most common stains which are being used. Now, what is the most common cause of the death whenever there is any pelvic fracture? Simple thing. Nobody will die due to bladder injury. Some will die due to neurogenic shock. Most will die due to hypovolemic shock if you don't attend like a house surgeon, because they will get acute tubular necrosis and mortality. Everyone is correct. Akshara is double A, confident about it. Tirupati also says hypovolemic shock. Sentinel lymph node biopsy, if you do for the carcinoma of the breast, what is that nerve which is highly vulnerable to get injured in sentinel node biopsy? You like to say serratus anterior? How many people were seen with winging scapulas after a breast cancer biopsy? What is the recent news? Today newspaper is Angelina Jolie got bilateral mastectomy, and get ready, just because genetically she is found to have vulnerable genes, planning for a silicone breast implant. So give me one confident answer. Question number 15. Kamal says A. There is a fight between A versus C. Only one person, Jyoti, said B. Sujata said B. Bindu also thought B. But my answer would be intercostobrachial nerve. If you look at the complications of the sentinel lymph node biopsy, damage to the intercostobrachial nerve is typically less common, but it does happen. Compared to that of the complete axillary node biopsy is what need to be remembered. Take some more printouts. This is an interesting question, achievable question. Due to popularity of the refrigeration, reducing the need to preserve the food, which malignancy dramatically declined? Give me one guess for that. You thought it as stomach? Stomach, very good. Any other guess? Bindu, what do you think? Stomach. What is the reason? Fahima, Akhil, Jyoti, Akshara, everyone is saying stomach. Super. So there is a clear-cut evidence of relationship between the dietary pattern and the stomach cancer. Consumption of the tobacco extract, tuibur, is linked to high rates of stomach cancer, especially in Mizoram. Consumption of red chilies and food at very high temperature and alcohol are the main risk factors for the stomach cancer in India. And the food preservation by refrigeration dramatically decreased the incidence of the stomach cancer. Now, this is an interesting question. Left scrotal swelling. If it were to be right scrotal swelling, I would have thought it as varicocele. Varicocele means, right varicocele means, you need to contemplate renal cell carcinoma. Left varicocele is otherwise common, right? But patient has left scrotal swelling, probably due to direct metastasis, smoking history of 35 packs with microscopic hematuria. What is your confident answer, doctor? Do you want to choose between, I know, seminoma, or do you want to say renal cell carcinoma? Question number 17. Most of them say B, seminoma. Some of them also say C. Yeah, Vijay Rohit says in this In this case, 65-year-old has been given. So Vijay Rohit's addition of 65-year-old to this question makes it altogether more important to suspect renal cell carcinoma. Anybody above 50 presenting with microscopic hematuria, unless proven otherwise, must be evaluated for a potential possibility of, especially with the smoking history, for renal cell carcinoma, which becomes the answer. What is meant by damage control surgery? Any confident answer? Don't do surgery that it causes damage. Or try to control the damage that happens because of the failure of surgery. Because your patient's attendance will damage you the window glasses of your nursing home. What is your answer? Question number 18. Rohit, Kunal, Akshara, Fahima, everyone say, give a minimum intervention. Don't do any anatomical correction. Stabilize the patient so that later on anatomically correcting surgery can be carried out, which is basically called damage control surgery. Very good. There's a neonate with meningomyelocele, and how do you want to cover that meningomyelocele? In a sterile gauze soaked with, examiner almost putting the laddu in the mouth. Rama is a good dash. What is your answer? You will definitely say boy, like a parrot. So this is such a standard question. What is your answer? 19. Rohit, Shahila, Guntur, Krishna, Kumar, everyone is saying normal saline. Soaked with normal, even omphalocele also. Before operating, if omphalocele with a exposed intestines are there, cover it with a soaked with saline gauze so that you will prevent evaporation and dehydration. This is a beautiful question. Lithium can affect the neuromuscular blockers. How many days before surgery you want to stop the lithium in your maniac depressive patient? He is already depressed that you are operating him, and he can become maniac in the operation theatre. What do you want to do? I found a very popular wrong answer on the internet by most of the people who voted on a poll. Question number 20. Jyoti, Kavi, Akhil, Akshara, everyone says 2 days. That's what I am wondering. What do you say? Actually, there is one chapter in anesthesia book. Which drug should be stopped 1 week before, 2 days before, on the day? Need not be stopped on the day of surgery, etc. My confident answer will be 1 day. Oral anticoagulant should be stopped. Aspirin may need to be stopped up to 7 days before surgery. Estrogen containing OCP should be stopped at least 4 weeks before surgery. Lithium should be stopped 24 hours prior to the surgery. Hypoglycemic agents need to be omitted on the day of surgery. So this is what you need to fundamentally remember. Now, this is a very, very standard question. Once more, Ramu is a good dash kind of a question. Salivary gland tumor, hot spot, technetium scan. Adenolymphoma. I don't think nobody will think of pleomorphic adenoma. Warthin's tumor or adenolymphoma is the benign tumor of the salivary gland. Typically, by technetium 99 pertechnate scan, you will be able to diagnose without biopsy, because it is the only salivary gland tumor that produces hot spot, is what need to be remembered. This is another very disgusting question. Abdominal aortic aneurysm is very common finding in lot of people. Above 65, anybody has atherosclerosis. If you do ultrasound in a asymptomatic patient, you will find aneurysm. Will you repair that? Generally, you don't repair. Based on the size, so many criteria when you should repair. That we are talking about the elective repair. But examiner is asking emergency repair mein, what is the mortality? Question number 22. Superb. Kumar, Akhil, Kavi, Guntur, Krishna, everyone says more than 50%. You all agree with that? I am very happy to find nearly about 49 online viewers and about 100 students in all centers put together able to enjoy a live online discussion. Some sitting in the home, some in the centers. So, give me one confident answer. Statistics, mortality statistics are different. If you take 30-day mortality after repair of a non-ruptured aneurysm, it was 0.2% in good risk and 2.2 in high risk. Overall 30-day mortality after emergency repair in a study done on 1037 patients in Mayo Clinic has shown 21.2%. That makes my answer become B. I don't know what's there in examiners. If you do in 10 patients and half of them died in your hospital after you have done the repair, my answer become wrong, right? But it was 1037. Then a 5-year child burnt with boiling water. What is the method which is used to calculate? Rule of 9? If it is rule of 9, it is not called All India Institute of Medical Sciences. If it is only rule of 9, in a 5-year-old child, it is not All India Institute. There is a special method in children. Question number 23. Kamal Kamal proposes everyone is saying A. Lund-Browder's chart. Lund-Browder chart is used to assess the burned body surface area. Palmar surface, everything, blah, blah, blah. I leave it for you to review in the literature. So, burns, there are nearly 2 questions. So, next time if you have not reviewed burns and gone to exam, shoot to burn in the November exam. So, you need to know what is the pattern, what examiner want. That is what we need to prepare rather than what we want to prepare for in the entrance. Circumferential burn of the thighs, buttock, face and scalp, what is the percentage? So, this is one thing, doctor. 13.5, 13.5 is both the limbs, and head is about 18% and chest is about 18%. Based on that, you need to carry on the calculation. Okay. Now, a driver wearing seat belt applied a crash brake. Then which organ most commonly injured? Question number 25. Give me one confident answer, doctor. Rakesh is proposing mesentery. Anybody else want to propose spleen or liver, which are temptingly calling you? But classical seat belt injury is equal to, if you thought about answering something else, then you are too early for May, too late for May and too early for November. Question number 25. Akshara, Praful, Kavi, everyone is proposing mesentery. That's right. Today we have some of our classical regular students, Manu, Meena, Gaikwad, they are all I think in evening duties or night duties. We are missing their answers. Now comes the anatomy. Pleural tap, whenever you are doing, what does it basically pierce? The needle. All this it will pierce except, very standard question in exam. What is your answer? Common sense. There are 2, parietal pleura, visceral pleura. If it pierces visceral pleura also, then it is definitely bound to pierce the lung, right? So that's the reason it doesn't. Question number 26. Akshara, Sujata, Kumar. I think for the earlier question they answered it as C. For this question everyone is answering it as D, pulmonary pleura. That's right. Anorectal ring fundamentally is formed by all except, another standard anatomy question. You like to propose? C. Internal anal sphincter. Good guess, wrong answer. We have not yet finished anatomy. One more week we have anatomy this week to bury the anatomy in memory. Question number 27. Oh, even Vijay Rohit thought it as internal anal sphincter. Shahila, Kumar, Tirupati, Harika, everyone is answering it as internal anal sphincter. Is it? But if I give you a contrasting answer, anorectal junction is formed by the fusion of puberectalis, deep external and internal sphincter. All the three. They typically form the anorectal ring is what need to be remembered. Kluver-Bucy syndrome. Our favorite question in neuroanatomy. Yesterday everyone was crying. 10 days neuroanatomy is too much, sir. When we will finish anatomy and by October can we finish all the Monday to Friday sessions? Can we finish the syllabus? We will definitely finish the syllabus. We already finished ophthalmology ENT. Today you are going to see ophthalm ENT questions. They will all be cakewalk for you. All the high yield topics which we listed, it is the same topic pattern. Examiner respects the typical pattern of high yield topics which you need to cover. So what is your answer, doctor? Question number 28. We find hypersexuality, visual agnosia, hypermetamorphosis but not seizures. Seizures are not the part. Question number 28. Fahima correctly answers it as seizure. So they can have hyperphagia, hyperorality, docility, hypersexuality, placidity, tameness, and etc. etc. And visual agnosias. Seizures is not a part. Floor of third ventricle, which structure is not there? Highest number of questions, even in undergraduate papers I have analyzed, ventricles are the favorite short answer question in the anatomy first year. So, what is your answer? Third ventricle. It's a part of which structure in the brain? Telencephalon, diencephalon, or myelencephalon, metencephalon, which part is it a part, so that you can answer. Question number 29. Very good. Femita, Guntur, Priya, Rohit, everyone say third nerve is not a part. Third nerve is a midbrain structure. Whereas third ventricle is a diencephalon. So mammillary body, infundibulum, optic chiasma, they are all basically diencephalic structures. If you know that, you can be able to answer it. Okay, doctor? Now, loss of lacrimation, once more our favorite question. Many times we discussed which glands are involved. It is the greater Peterson nerve, whose injury, it provides the secretomotor fibers to the lacrimal gland, as all of you know very well. It also provides secretomotor fibers to the mucosal glands of the nose, palate and pharynx. Now, a pregnant lady has juvenile myoclonic epilepsy. Which drug is the best one to prevent the seizure in the children? I mean the child born. Which anti-epileptic you want to give to a pregnant lady which is still safe, which can also treat myoclonic seizures? First you must know which drugs are for myoclonic seizures and which are safe in pregnancy. Classical drug for myoclonic seizures is valproate. But can you give valproate in pregnancy? Can you give carbamazepine safely in pregnancy? Or is it useful in myoclonic seizures? Once more, that is the issue. So question number 31. Everyone, Kamal, Kunal, Tara, Kirti, except Rakesh, everyone say levetiracetam. Absolutely right. Most effective drug is valproate, but lamotrigine, levetiracetam, topiramate, jonicamide are the ones who are typically used safely in case of pregnancy to manage the myoclonic seizures. Now this is a very standard question, doctor. If you do vaginal candidiasis culture, which we generally don't do, clinically only we identify with the pruritus and the white lesions, 80% which candida species are they is an important question. Give me an answer, doctor. Question number 32. Yes. Already answer is there. So albicans, not at all glabrata. To avoid mother-child transmission of HIV, what is the best option which is available for you? Very easy questions these are all. AIMS can't be that easy as much it is in this May session with this kind of questions. Around 140 questions are skating. Remaining 30-40 are mountain climbing. Another 10 are scuba diving. If you don't know, you are into the depth of water. Question number 33. Everyone is saying perinatal oral zidovudine is the one which is encouraged. Absolutely right. Now this is another very enigmatic question. Fetal breathing movements. Do you think they will increase towards the term? Will they help conditioning the respiratory muscles? Will they lead to aspiration of amniotic fluid? Will they cause respiratory distress? I am not still sure between A and B. C and D are common sense. Towards the end of the pregnancy, breathing will increase, they condition respiratory muscles, but A and B I am not sure. Why B I am not sure is, breathing movements will enable the secretions to leave the body and enter into the amniotic fluid. It is not the amniotic fluid entering in whenever the baby breathes. If the baby doesn't breathe, there is a more chance of aspiration. Okay. So maybe A or B, somewhere it is lying. I don't know what was the answer. But anyway, as I told you, I am the king Dhritarashtra. I didn't take the exam, but based on your narration, I am able to come to some conclusion. Okay. Question number 35. This is a very standard question. What is the urinary metabolite of progesterone? Classical metabolite, which we use for the evaluation of adequacy of the progesterone, any condition like congenital adrenal hyperplasia where progesterone levels are higher, to assess the progesterone levels in urine. Question number 35, Vijay Rohit correctly says pregnanediol is an inactive metabolic product of the progesterone. A test can be done to assess the amount of the pregnanediol in the urine is what need to be remembered. In a healthy female, when will ovulation occur? Something is missing in this question. It is definitely not before LH, sir, you all know. Nobody will choose A. Did anybody choose A? No. Then, after follicular ripening caused by FSH, immediately will ovulation occur? Follicular ripening should occur, it should release estrogen. Normally, estrogen inhibits the gonadotropin hormones, but before ovulation, the rise will paradoxically stimulate the LH instead of inhibiting LH, and that lead to LH surge. After LH surge, there is an ovulation. Cervical mucus does not break down, so D is out of question. I think most likely B should be the answer. Basal body temperature and the ovulation both will match each other. Question number 36. I know, except Sujata and Kumar, everyone is saying B. They thought it as C. C is a very narrowly inviting answer, which is not true. Now, a female 15-year-old from a hilly area presenting with weight loss, low grade fever, no pain abdomen. What is the most likely diagnosis? Is it pelvic inflammatory disease or genital TB? Always Generally, the rule is in a virgin, whenever there is any infection, pelvic infection, it is unlikely to be due to PID, but we should suspect tuberculosis. Altogether, with the history of weight loss, it is more likely to be tuberculosis, genital tuberculosis. That's right. Rakesh, everyone is saying the same. At 6 weeks, if you want to assess a viable pregnancy, just not pregnancy. Viable means cardiac activity should be there. So, what is the best way? You like to use vaginal ultrasound for cardiac activity? Will it be able to pick up as early as the TV ultrasound? Transvaginal ultrasound. 38. Akshara, Kirti, Sudha. Everyone is correctly answering. Vaginal ultrasound is what need to be remembered. That's good. Now, doctor. Painless raised indurated ulcer with everted margins at labia majora. Without a question on one of the sexually transmitted diseases, one of the 4, there is no entrance exam. Standard paper. What is your answer? Painless is always painless hard. Classical of question number 39. I know. Vijay, Rohit, Akshara, Sudha, Shahila, Kunal. Everyone is saying Treponema pallidum, syphilis is the one, nothing else other than the syphilis. In the active management of the 3rd stage of the labor to avoid postpartum hemorrhage, all these things are done except what? Answer is evident to the eyes. Directly it is very inviting answer. What is your answer? You like to say C or A? See, why you don't want to clamp the umbilical cord early? One of the ways of active management of the labor. Classical description. Any other answer? B, misoprostol, wonderfully can be used. Oxytocin, yes, we can use. But when to use oxytocin? After, before, during, after, right? I think that after is the laughter part of it, I think. But most of our students say C. Question number 40, except Harika is now committing it as A. Because clamping is in 2nd stage of labor, says Vijay Rohit. No, sir. I voted for A. I'll give you. Physiological versus active management. Number 1, you give uterotonic with delivery of the anterior shoulder of the baby. Giving uterotonic is part of active management. Assessment of uterus is part of both physiological and active. Controlled cord traction, Brandt Andrews maneuver to deliver the placenta is cord traction, active management. Early cord clamping is a part of the active management. So that's a clear cut. Gynocs, doctor, 30 out of 30 if you don't score. Where else will you score? It's like inorganic chemistry in our +2 days. 50 out of 50 you should get in chemistry to get a medical seat. Right? So, gynops like subjects are like that. Medicine is like physics. If you can get more than 40, you are definite to get seat. All the remaining subjects are like biology. Right? Which you are expected to be already good with. Anatomy and all these things. Yeah. Krishna also says clamping. I have made my stand very clear. You can once more review and correct me. Now, a woman after normal labor suddenly goes into shock. Suddenly goes into shock is not PPH, doctor. She will slowly go into shock in PPH. I still remember one of our my own classmates, my immediate senior's wife succumbed to this complication. Very unfortunate. Where one of our other friends had given anesthesia. No one, it is not in hands of anyone. Question number 41. That's right. Kunal and Sanjay are saying inversion. Kavi and Priya are saying amniotic fluid embolism. That's very important. During the labor, but has occurred during abortion, after abdominal trauma, and during amnio infusion, where there is a sudden development of death. Right? So, in the late stages of the labor, patient become acutely dyspneic with hypotension. She will experience seizures also, followed by cardiac arrest. Everything happening dramatically where things can go out of your control. So, Duncan's method of separation of placenta. What is your answer, doctor? You like to say? Retroplacental hematoma, D. B. Maternal surface of placenta presents at vulva. Yes or not? Any other answer? Blood accumulates between placenta and membranes and escapes through vagina. True or false? Question number 42. That's right. Vijay, Rohit, Kavi, Akshara. They're all very strong with their answer. It is not the commonest method of separation of placenta. What is the commonest method then? Scull's method, Matthews, Duncan. They are the two methods of separation. And neither of these are under the control of the birth attendant. Scull's is said to be more common. In the Scull's method of separation of placenta from the uterus during placental expulsion, placenta detaches from the central point, whereas in the Duncan's method, from the periphery, rim, it typically becomes separated and comes out. And all the remaining things are all true. I leave the literature for you. This is easiest question. Maternal versus fetal RBC. Still, if any innocent person answered it as Kleinhoyer and Burke. Betke. Kleinhoyer, Betke, if somebody answered, we will give a free coaching to them under challenged situation under GOB. Right? So, what do we use Kleinhoyer, Betke for? If a ABO negative mother with a O positive baby, you are worried that some amount of the fetal blood entered into the maternal circulation. How much it has entered you want to quantify, then you do the Kleinhoyer-Betke, not the apt test. But apt test is basically to know whether it is a fetal RBC or a maternal RBC. We do the apt test is what you need to fundamentally remember. Fahima said, Fahima is our already joined student, no more discount. So she also thought it as Kleinhoyer-Betke. So then I enjoy if anybody does wrong, because that is where there is a sadistic pleasure of discovering others wrong and we becoming right. That's called as MD entrance preparation, right? So, doc, 16-year-old female, no problem. You can still another 4-5 months time is there before another opportunity of AIMS November will once more come back. 16-year-old female, many times we discussed it in our Sunday exam. Normal pubic hair, normal breast, absent uterus, vagina with primary amenorrhea. Here the challenge is there only between option B and C. In androgen insensitivity syndrome, why do you get normal breast? Because androgen insensitivity syndrome is fundamentally XY. karyotype. They are karyotypically males, but their testis is inside their abdomen, and testosterone is produced by them, but it can't act on the receptors, but it will convert into estrogen, and that estrogen, testosterone which became estrogen, will lead to the development of the breast. So that is the reason breast development is normal. I mean, is like a feminine pattern in androgen insensitivity. But if the testosterone doesn't act on receptor, pubic and axillary hair doesn't grow. So absent pubic and axillary hair with a good breast is equal to androgen insensitivity, right? Then what happens in the case of the Turner syndrome? Short stature, webbed neck, widely spaced nipples, and estrogen deficiency state it is because of the ovarian dysgenesis. That doesn't come into the game at all. But what is Mayer-Rokitansky-Kushner syndrome? Mullerian agenesis. So that is the reason there is an absent uterus and vagina, but pubic hair breast development is just like any other female, because XX is the underlying karyotype in them. So what is your answer, doctor? Question number 44. Kumar punches 7 bees. So confident, right? Very good. So what is the rule? Any AIMS exam you go, doctor, one question invariably on congenital adrenal hyperplasia or Kushner-Hofstadter syndrome or androgen insensitivity syndrome. Without that, these transsexual states, without that, there is no paper at all. You can take it granted. Very predictable exam is the AIMS. A girl, short stature, widely spaced nipples, web neck, primary amenorrhea. Who else? Who else it is? It is 45X4, Turner. Well, Turner will have mental retardation. Another common question asked by the examiner. A Turner can become IAS officer. Turner can become ND entrance topper. Turner can become Prime Minister. Turner can become anything. They are intellectually absolutely normal. There is no problem with regard to that. Recurrent abortions with pain in calves is which hypercoagulable state? Deficiency of what? Protein, yes. I think easiest question. You will sabotage this in the exam. Question number 46. Everyone is answering it as protein C, protein S deficiency classically. There can't be no other answer. Krishna punches 2 A's. Kavi also says A. That's good. From where is the vaginal epithelium is derived from? Another very predictable question of AIMS May 2013. When is the PGA exam? 19th. So post PGA we will have a discussion on the paper. So what is the purpose of these discussions is once more to make sure ourselves that entrance is not a difficult thing to crack. It is highly predictable. If we review, I will give you the 1250 most high yield topics. What to be read before exam? 90% of paper will come except cell injury caused by needle. What will happen? That kind of questions is not in your control. You can leave it. One question was about father of neurootology. Who will remember who is the mother of somebody was asking, one of the students asked me once, sir, why for everything father is only there, mother is never told, I mean on a lighter vein, why there is no mother of radiology, why only we always say father? So, vaginal epithelium is derived from, what is your answer, doctor? Akshara, Shahila, Sujata say A, Sudha says B. A, you all agree? Urogenital sinus, endoderm is the one which typically is responsible for the vaginal epithelium. Hormone replacement therapy in postmenopausal women, what is the present recommendation? It is indicated for what purposes, and for what purpose it is not really helpful. In fact, it can be deleterious. Do you use it for taking care of that hot flushes of menopause? Yes, it is indicated. To prevent osteoporosis, indicated. But there were conflicting results when it comes to coronary artery disease, the role of the HRT. Hence, there are no definite recommendations for the CAD. Question number 48. Everyone, Sujata, Shahila, Rohit, everyone is saying prevention of coronary artery disease. Now comes the sleep promoting medicine. SPM. We need to get over it. 2 minutes will be out of video to take a backup into the server, and tonight we will be hosting this discussion on YouTube on a free channel, youtube.com/onlinembbs. You can tell your classmates who missed today's discussion to log into the YouTube to the channel and can have a review. So that's the whole idea. So 2 minutes will be out of video.